Welcome to this educational program. This module describes a medical procedure called cystoscopy. It is written by specialists in this field and is independently produced. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. Cystoscopy is a medical procedure in which a doctor looks into the bladder and urethra, or urine channel, with a special telescope. The procedure allows the doctor to diagnose or treat certain conditions of these structures. It is usually a simple outpatient procedure done under local anesthesia or freezing while you are awake. Sometimes, however, it does require intravenous or IV sedation to keep you drowsy, or even general anesthesia where you are put to sleep, or regional anesthesia where your body is frozen from the waist down. As mentioned, cystoscopy can be used to either diagnose or treat certain conditions. Situations requiring cystoscopy for diagnosis include blood in the urine, significant urinary symptoms, the inability or difficulty to pass urine or empty the bladder, painful urination, repeated urinary tract infections, and abnormal findings on X-ray, ultrasound, CT scan, or other imaging studies. Conditions that may be treated with the assistance of cystoscopy include bladder conditions, such as tumors or various types of inflammation, and prostate or urethra conditions, such as an enlarged prostate or scar tissue in the urethra. Typically, there is no special preparation required if you are having a simple cystoscopy under local anesthesia, although your doctor's office or clinic may advise you of specific requests. It is probably best to eat a light breakfast or lunch prior to the procedure. If the procedure is to be done under general anesthesia, you'll be asked not to take anything by mouth, usually after midnight the night before. As with any medical appointment, it is helpful to bring with you a list of your medications, including supplements, and allergies. Please also advise your doctor and the clinic staff if you normally take antibiotics before dental and other procedures, or if you have a known heart murmur, artificial heart valve, or recent placement of any foreign material, such as an artificial hip or coronary stent, etc. Unless otherwise instructed, you should take your usual medications on the day of the procedure. The next few slides will explain how the cystoscopy procedure is performed. In men, cystoscopy involves the passage of a small flexible telescope into the bladder with the patient lying down. A rectal examination to feel the prostate may be performed afterwards as part of the assessment. Women have a shorter, straighter urethra, so a small straight telescope is usually used, with the patient's legs up in stirrups. A pelvic exam, if not done already, may be included in the visit. Cystoscopy is usually a very quick outpatient procedure. After positioning, the skin is cleansed and freezing jelly is passed into the urethra to numb sensation. Most patients should experience minor discomfort only, which is minimized by taking deep, slow breaths and relaxing as much as possible. You may feel anything from a cool sensation or pressure in the urethra to a slight burning sensation with passing of the freezing jelly. Some patients describe it as feeling like they are urinating backwards. You may feel more pressure with passage of the scope and a cool sensation as the bladder is filled, then a sense of fullness or a need to urinate. If done with general anesthesia, of course, you will feel nothing at all. At the time of cystoscopy, other testing or procedures may be performed, depending on the situation. These may include a pelvic or rectal examination, biopsy of the bladder, removal of small stones from the bladder, X-rays such as retrograde pyelogram, cystogram, or urethrogram, placement or removal of a urinary stent, dilatation or stretching of the urethra, or injection of certain agents into the bladder or urethra. Some of the more common procedures are discussed on the next few slides, and others may be covered in other modules. A bladder biopsy involves a removal of a small piece of bladder lining to examine under a microscope, and may be required when the lining looks abnormal. For this, a small instrument is passed through the scope and grasps and removes a small piece of bladder lining. If there is some bleeding, the area may be cauterized with another small instrument. This seals the bleeding blood vessel. During a bladder biopsy, you may feel a pinching sensation, and afterwards you may notice blood in the urine for a short time. Occasionally, at the time of cystoscopy, a retrograde pyelogram will be required. This is an X-ray test where contrast dye is passed up from the bladder to the kidney through a small tube passed through the cystoscope and up into the ureter. This is an excellent method of examining the entire ureter and drainage system of the kidney. A urinary or ureteric stent is a long, narrow tube extending from the kidney to the bladder, which helps to maintain drainage of the kidney. Stents are usually placed through a cystoscope with X-ray guidance. Sometimes a string is left attached to the stent to make removal of it simpler, but often another cystoscopy is required to remove it. Following cystoscopy, you may feel the need to urinate right away, and there may be burning with urination, frequent urination, or blood in the urine. This should not last long and usually clears up after urinating a few times. Normally, you may drive home unless you have received sedation or general anesthetic. Once home, you should drink plenty of fluids, and you may resume your normal diet. If you experience discomfort, a warm bath can help ease this by relaxing the pelvic muscles. Depending on your situation, your doctor may prescribe medication for you. Otherwise, you should not need to take anything other than a mild pain reliever such as acetaminophen. Cystoscopy is a commonly performed low-risk procedure. As mentioned, blood in the urine is common afterwards and usually clears quickly and is of no consequence. There is a low risk of infection, likely less than 1%, and this is minimized by drinking plenty of fluids after the procedure. In some situations, and with certain doctors or clinics, antibiotics may be given around the time of cystoscopy. Some patients may experience difficulty urinating after the procedure, or more frequent, urgent, or painful urination. This can be lessened by focusing on relaxing the pelvic muscles when urinating. Any time that instruments are passed through the urinary tract, there is a small risk of later developing some scar tissue there, which can lead to symptoms of a blocked urinary stream. The risk of this with modern instruments is very small. Having said all of this, you should contact your doctor if you experience any of the following after cystoscopy: sudden chills or shaking, a fever of more than 38 degrees Celsius or 100.4 degrees Fahrenheit, cloudy or foul-smelling urine, new severe pain, burning lasting more than 2 days, blood in the urine lasting more than 2 to 3 days, or significant difficulty emptying the bladder. In summary, cystoscopy is a simple and common outpatient procedure used to diagnose and treat conditions of the bladder and urinary tract. It is well tolerated, causes minimal discomfort, and is associated with minimal risk. These resources may help you find further information about cystoscopy. This is one modern reference discussing cystoscopy available at your local medical library. We hope that this module has furthered your understanding of the cystoscopy procedure. We wish you the best for the future, and thank you once again for viewing this educational program.